Hey there everybody, Sage Apopum here, founder of the School of Evolutionary Herbalism, and thanks so much for taking the time out of your busy day to tune into the channel here and check out our content. Really appreciate it. And this is a little bit of a different kind of a post. I don't get up on a soapbox and I don't really rant too much, but this was something I thought I wanted to kind of share because I feel like it's one area of the work that I do and what I teach here at the School of Evolutionary Herbalism that is probably one of the most misunderstood aspects of kind of my approach to herbal medicine, and that is the piece of medical astrology. And it's kind of a funny name for the post, why I wish what I did wasn't called medical astrology, but I'm gonna explain why I kind of do wish that it wasn't called medical astrology. So a number of months ago, I had traveled to a big herb conference, the American Herbalist Guild Symposium, and it was my first in-person herb conference or event in like a really long time, definitely since before COVID. And it was really great. I had a great time. It was an amazing conference. AHG did a really great job, amazing content and great teachers and really well done. It was great. It was the first time I'd ever taught at an AHG symposium, so it was a real honor to be a part of it. But I had a number of conversations there with a number of people, and that kind of inspired me to do this post. And conversations with some of the attendees, some conversations with some really well-known and renowned herbalists, and I started to notice a theme, and that kind of was like, yeah, it's neat what you do. It seems really interesting, but the whole medical astrology side of it is BS. And, some said, like, I don't really think medical astrology or astrology at all has any place within the context of herbal medicine. And it was like, wow, that's interesting. And, I did my best not to get to, get my feelings hurt, because medical astrology is a big part of the work that I do, and it just really made me think about like, well, why is that? And I found it very interesting that a lot of people that are really into herbal medicine would just kind of discount an entire branch with a very deep lineage and tradition, more often than not, without really knowing anything about it. And, I think astrology has a really bad rap, I think, in kind of conventional culture. It's really seen and misunderstood in a way that is kind of not very accurate. I think a lot of people think that astrology is just like, foretelling the future, or seeing into, just, I don't know. Well, I think a lot of people just think the whole thing is a bunch of BS. And I think for a lot of folks too, they don't really know how to explain it. Like, it's inexplicable. Like, there's no scientific explanation for how astrology works, right? And if there was, I'm not familiar with it, and it would probably be way too complicated for me to understand anyways. But it just led me to some interesting thoughts. I mean, at least to me, they were interesting, where it's like, people don't really believe in it. And I always think like, well, where does belief have to do with any of it? If you do something and it works, you don't even have to believe in it. You just know that it works. And I feel like when someone doesn't have an understanding of a particular lineage or tradition or approach to doing things, they don't know anything about it, and then the whole thing gets discounted and thrown out without really knowing anything about it, without even seeing how it works, to me just feels a little like, and then to like really openly kind of sometimes put it down. I don't know. For me, I really strive to have an open mind. And if someone does something and it works, I think that's a good thing. To me, herbal medicine is about helping people. Herbal medicine is about being connected to the medicinal intelligence of nature. And if we are able to utilize a model and an approach to things that helps us to effectively do that, right? To help someone that's sick, to heal someone that is suffering, to improve the quality of life of someone, I think that's a good thing, and I don't think that thing should be discounted, regardless of what tool we use what tool we pick up from our toolbox, right? Regardless of whether you're using Ayurvedic Tridosha theory or the 5-element system of TCM, or whether you're using 6 tissue states, or whether you're using biochemical analysis of the blood and hormones, or whether you're assessing someone based on their planetary constitution and their natal chart. What difference does it make if the end result is someone getting better? And so this is kind of one of the reasons why I wish it wasn't called medical astrology, because as soon as people hear that word astrology, it's like, what? That's a bunch of BS. Or what? How could that possibly work? But it's like, well, I have an iPhone. I have absolutely no idea how my iPhone works, but I use it and it works. I have a computer. I have no idea how that computer works, but it works. It's like we're using things all the time in our modern world that we have no idea how they work, but we utilize it and it works. And that's kind of the way I think of medical astrology. It's like, yeah, I can't scientifically explain how looking at a chart and I can figure out someone's constitution and what their predispositions for disease are. But I know that when I see a client and I pull their chart, I can very clearly pinpoint what's going on for them, what the imbalanced organ system is, where the tissue state pattern is, what the constitution is, as well as what types of remedies are going to be remedial. Medical astrology is not something that someone just made up. It was developed, as were all of the great systems of medicine from around the world, through observation, through postulating theories, through testing it, through refinement. And, medical astrology would not still be used to this day if it didn't work. Same is true for acupuncture. I always think it's so funny when we meet someone these days that's like, acupuncture? I don't believe in acupuncture. And I'm like, what do you mean you don't believe in it? There's nothing to believe or not believe in. It's like a thousands of year old tradition. Do you think it would still be practiced today if it didn't work? I think practicing medicine and healing is one of those areas where if something doesn't work, it's not going to stick around. And I think that same argument holds sway for medical astrology, that it does work and it has been in practice cross-culturally for a very, very long time. And it's incredibly accurate. To me, it's another tool in the toolbox. And for me, in the way I approach things, it really is right next to other methods of assessment and evaluation of a client. So it's right there with doing a good intake and an interview and visually assessing someone, looking at the color of their skin, looking at their tongue, the patterns on the tongue, feeling their pulse, all of these different ways we have to holistically assess someone. The medical astrology piece is right there as well. And, a really great example actually for a case that I was just recently working on. This person had some health concerns that, on the surface, can be indicative of a much deeper problem in the body, specifically looking at really intense swelling in the lower extremities, edema. And, from a allopathic herbal standpoint, it'd be like, just give some diuretics and flush the fluids out and the edema will go down. Drink dandelion leaf tea or something, or nettle leaf tea. Yeah, that can work maybe, but that's not really getting to the root cause. The root cause of something like that can be something much more deep. It can indicate a kidney problem, it can indicate a heart problem, it can indicate liver issues. And as I was working with this person, I was kind of having a little bit of a tricky time kind of starting to assess what might be behind it, like what might be at the root of this issue. And so I pulled up the chart, and like clear as day, it was all right there in front of me, right? There was all of these patterns that pointed straight to the liver, right? Lots of stuff going on with Virgo, ruler of the liver, in challenging aspect with Jupiter, ruler of the liver, also in challenging aspect with the nodes of the moon, which rule excesses and deficiencies, in conflict with Saturn, which tends to create weakness and stagnation of the vital force. And it was like very clear right there, oh, I think there's a deeper liver issue going on. And then sure enough, further on into the intake process, I discovered that this person had actually contracted hepatitis at a young age. This person is, you know, I don't know if I would consider them elderly, but you know, they're in like their 60s. I don't know at what age someone is considered elderly. But you know, the doctor said it had gone away, which I'm not really totally sure if that's true. And so what it ended up doing was leading me to have a postulation and to a theory, and said, hey, you know, I know the limits and scope of my practice. And so I said, hey, you know, I think there might be something going on here. I'd like for you to go to an MD, get some blood work done, get some testing done, and make sure, you know, we want to make sure that there isn't something really serious going on here. And she did. And sure enough, results came back that there's some deeper problems going on with the liver. So my point is that like that's accuracy, right? That's pinpointing the root cause of a problem. And the medical astrology was just another tool. There was things on the tongue that also pointed to liver stuff. There was things in the complexion of the skin that pointed to others. There were other symptoms going on that pointed to liver stuff. But the medical astrology was kind of one of those key testimonies, right, that pointed towards this, that helped to clarify and confirm it for me. Whereas another practitioner might have gotten that from reading their pulse, right? I mean, doing consultations at a distance. Obviously, you can't read someone's pulse from a distance, but you know, someone else might have come to that conclusion through iridology. Someone might have come to it through reading facial lines, reading the body in other ways. Again, there's so many ways that we can assess people. But it's not so much the tool you use, it's is the job getting done, right? Are we coming to the right conclusion that leads to a good protocol and remedy selection and formulation, possible supplemental lifestyle things that will help to intervene and help the person out, right? And so I just share that as an example because it was just like, I use it all the time, and it never ceases to amaze me how well it works. And so for those of you, and you know, it's strange because a lot of the folks watching this video probably have an open mind to the use of medical astrology in conjunction with your herbalism practice. But if there are any of you that are skeptical or downright just shun it, push it away, think the whole thing is BS, I would encourage you to, at the very least, not say that it isn't true or doesn't work, because it actually does. And if you were to take some time to actually look into the system and to study it, you would actually see that it's very pragmatic and very practical, very physiological, very mechanical, actually. I mean, my teacher in medical astrology literally refers it to like astral mechanics. It's like very kind of mathematical and linear in a way. And, you know, I think that's important to understand because we're looking at the body. And to me, you know, the other point that this kind of brings up is that obviously astrology, you know, medical astrology in and of itself is physiologically oriented, right? We're looking at constitutions, organ systems, tissues. We're looking at pathology. We're looking at plants and medicinal properties and therapeutics and formulation. Like that's the sphere of medical astrology, right? Which is the sphere of clinical herbalism. But of course, astrology has all these other branches that are much more esoteric, that are much more spiritually oriented, that are really looking at the soul or the our psyche, our psychological and emotional being. And, I would say in the realm of astrology these days, it gets pretty woo-woo, right? It can get very kind of lofty and get a little ungrounded and a little like, what are we actually talking about here? And, from what I've seen, what's funny, because when I first started talking about herbalism and astrology, like no one was talking about this stuff. Like there was no one out there teaching astrology and herbalism. I know because I was looking for them, like trying to find a teacher, and no one was doing it. And so I had to go, study with alchemists and study with medical astrologers and study with clinical herbalists. And then I've kind of put it together into my approach and the way that I use it, which is very effective. But nowadays I see people talking herbs and astrology all over the place. And I think that's good. Like, it makes me happy that more people are starting to work with astrology, with herbal medicine. But my fear, not my fear, but my sometimes hesitancy with it is that sometimes it's represented in a little bit of an inaccurate way. Like sometimes the esoteric, spiritual attribute of it is kind of overriding the more medical aspect of it, the more physiological aspect of it. Like they're not bridged together very well. And that can lead to a lot of people being very skeptical or just be like, what is this new age stuff over here? Like, what's this new age astrology herbalism thing? Like, that looks like a bunch of BS. And then that's discounting the whole like actual clinical application of it. So I think that's one of the things that I've noticed kind of observing what I'm seeing out there these days is there is a lot more people talking about astrology and herbal medicine, and and sometimes that clinical application of it is not so much the focus. It's more of the esoteric aspect of it, which is fine, I guess. But I think the only problem with focusing on that is that I think it can turn a lot of people off. And so this is actually why in my client work, I don't actually advertise the fact that I use medical astrology. Like a lot of my clients don't even know, right? In the same way that an acupuncturist probably isn't going to be like, oh, I'm going to take your pulse to assess your kidneys and lungs and the chi and blood and, like they're just going to take your pulse, right? And the person's going to be like, oh, okay, they're listening to my pulse or feeling my pulse. And then the practitioner usually is going to have to explain to the client how it all works. Again, to me, the medical astrology piece is very, very similar in that way, where it's like, they actually don't really need to know that you're using it. When I'm using medical astrology with a client, I'm actually not doing like an astrology reading. And I think that's what a lot of people conjure up. Like, oh, Sage is sitting there and talking through a chart with someone. It's like, I don't do that. That's not what I do. Because oftentimes, honestly, what is seen in a chart, you kind of have to be really careful what you say to people. You can't be like, oh, well, Saturn's here and, the sun's here and Leo's there. And, oh, well, these combinations, that kind of looks like a blockage in the heart. No, you had a family history of heart problems. Like, you can actually plant the seed of a problem in someone's mind and create a lot of anxiety and worry and potentially a self-fulfilling prophecy, right? So, in any clinical work, you have to be very careful and cautious with how you communicate to people. And the astrological chart is an incredibly powerful tool that can be used in a really powerful healing way, but it can also be used to harm. Oftentimes people aren't doing that intentionally, but I think because of a lack of awareness, or maybe trying to like show off how wise and how good at astrology they are, maybe they try to like say things to like prove something to someone, or kind of, it can sometimes turn into like a power thing. And I can't tell you how many people have come to me that have been like, yeah, I had like an astrology reading that messed me up. Like, it kind of affected me in a really negative way. Because honestly, when people go to an astrologer, they're pretty open. They're like really trusting what they say. And so for me, like, I leave all of that aside. And to me, the chart part of the work is always done typically after the consultation is done. It's a way of clarifying, verifying, validating what I gathered through the intake, the interview, the assessment. the case history and all of that. So anyways, it was a little bit of a different kind of post today, I guess, a little bit more of a rant and soapbox. But I thought, I guess just in my experience at AHG, it was like, it wasn't just one person or two people, it was like multiple people I interacted with. Like the medical astrology side of my work really turned them off, and some vehemently, in kind of an intense way, like we're just very clear, like, like that's a bunch of BS. And I was just like, wow, okay, interesting. There seems like there's a lot of like misunderstanding out there about what medical astrology is and how it integrates into herbal medicine. So there's my rant. I hope I didn't offend anyone or hurt any feelings, and I'm not like trying to like name call or anything like that. But I also feel like for me, there's also an aspect of like kind of like standing up for what I do and the traditions that I represent, right? So to me, I am trying to carry forth and preserve a traditional approach to working with herbal medicine, with the alchemical tradition, with the spagyric pharmacy, with medical astrology. And sometimes when I see them being misrepresented or misunderstood, I feel like it's part of my responsibility as someone that's carrying this way of working with people and plants to try my best to like represent it in a good way and to kind of like stand up for it, I guess. Not like in a degrading or in, I'm not trying to like be intense about it, but this is just me sharing a little bit of my perspectives and encouragement too, to everyone out there to try to have an open mind, try to have an open mind to how people work with other people. And if it's not for you, that's okay. But I think there's also like a respect factor too that can go into it, where it may not be your personal preferred approach, but I don't really feel like it's right to talk bad or talk down about an approach to things, especially like publicly, if anyone is doing that. Especially if you don't really understand how it works or how to use it, or have never really looked into it. So just my perspective. So sharing some thoughts here. Thanks so much for joining me in this video. Hey, if you're watching this anywhere but Evolutionary, herbalism.com. Head on over there. We got tons of free posts and workshops and all sorts of great content over there. Be sure to like and subscribe if you're on YouTube. It really does help support the channel. It helps people see our videos. If you want to support us here at the School of Evolutionary Herbalism, just click that little like and subscribe button. It sure does help us out a lot. Helps with YouTube's whole algorithm thing. And if you're listening on the podcast, be sure to subscribe. And hey, if you don't mind, leave us a good comment below and some feedback. Always open to people's thoughts. And really appreciate you once again for being a part of the Evolutionary Herbalism community. And until the next one, take care and be well.